Yes, women can lactate without ever being pregnant, though this is not a typical or common occurrence. Lactation is usually triggered by pregnancy, during which hormonal changes, especially increases in prolactin and estrogen, prepare the body for breastfeeding. However, lactation can happen in non-pregnant women through various mechanisms, some of which involve hormonal changes, medical conditions, or external interventions. Below are some of the key ways this can happen. Galactorrhea refers to the spontaneous production of milk in women, or even men, who are not pregnant or breastfeeding. The most common cause of galactorrhea is an imbalance in the hormone prolactin, which stimulates milk production. Prolactin is typically elevated during pregnancy and breastfeeding, but it can also be raised by other factors. Benign tumors in the pituitary gland, called prolactinomas, can cause excessive secretion of prolactin, leading to lactation. Conditions like hypothyroidism, an underactive thyroid, can also trigger elevated prolactin levels, which might cause lactation. Certain medications can increase prolactin levels, leading to lactation. These include antipsychotic drugs like risperidone, antidepressants such as SSRIs, and some blood pressure medications. In rare cases, extreme stress or emotional triggers can lead to hormonal imbalances that result in milk production. Some herbs and plant-based supplements like fenugreek can also induce lactation. Some women, particularly those who have never been pregnant, can be induced to lactate with the use of hormonal therapy. This is typically done when a woman plans to adopt a baby and wishes to breastfeed. Drugs like estrogen, progesterone, and prolactin may be administered to stimulate the breast tissue. Even in the absence of pregnancy, nipple stimulation, via pumping, breastfeeding, or other forms of tactile stimulation, can trigger lactation. This works by triggering the release of oxytocin and prolactin, which are responsible for milk production and ejection. Some women use nipple stimulation, sometimes alongside hormonal treatments, to induce lactation so they can breastfeed an adopted child. Hyperprolactinemia. This is a condition in which there is an abnormally high level of prolactin in the blood, which can be caused by factors such as pituitary tumors, chronic kidney disease, or other endocrine disorders. Polycystic ovary syndrome, or PCOS. Women with PCOS often have hormonal imbalances, including high levels of prolactin, which can contribute to lactation in some cases. In some cases, kidney issues can affect prolactin metabolism, leading to increased prolactin levels and lactation. Some rare types of breast cancer or other tumors can produce prolactin-like substances that cause lactation. In rare cases, women who have had a miscarriage or who are undergoing certain fertility treatments might experience lactation even if they do not carry a pregnancy to term. Some women report lactation after an abortion or miscarriage due to hormonal fluctuations, especially if the abortion or miscarriage was in the later stages of pregnancy. Spontaneous milk production from one or both breasts, clear or milky fluid from the nipples, sometimes accompanied by breast tenderness or swelling, may be intermittent or continuous depending on the underlying cause. If a woman experiences lactation without being pregnant or breastfeeding, she should see a healthcare provider. The doctor will typically conduct a physical examination and may order tests such as blood tests to check hormone levels, especially prolactin, thyroid hormones, and other relevant hormones. Imaging like an MRI or CT scan to check for pituitary tumors or other structural issues. Treatment will depend on the underlying cause. For instance, medications may be prescribed to regulate hormone levels, such as dopamine agonists for elevated prolactin. If a pituitary tumor is found, surgery or other treatments may be necessary. While lactation without pregnancy is rare, it is entirely possible due to hormonal imbalances, certain medical conditions, medications, and even intentional hormone therapy. If you or someone experiences this, it's important to consult a healthcare professional to identify any underlying causes and to determine the most appropriate course of action.